DocTalk is brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. We're tickled that you joined us today. My guest is going to be Dr. Matt Fair from Great Bend, Kansas at the Animal Medical Center, and we're going to talk about equine chiropractic medicine, probably touch a little bit on acupuncture as well. Thanks for joining us. Hope you enjoy the show.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. Welcome to the show.
Thanks, good to be here.
Well, folks, Dr. Matt Fair, who's friend and colleague, outstanding veterinarian here in Great Bend, Kansas, owner of Animal Medical Center. We're in the Equine Medical Center, which is a beautiful facility. And Matt, over the years, you've developed some new things to add in the practice, but the thing we're going to talk about is the chiropractic medicine and potentially some of the acupuncture stuff too.
Right, I kind of started into some of the alternative medicine. After I got out of school, I got into practice, and there was just cases that I wanted to do more for. I just had certain things that the medical treatments just wouldn't do as much as I wanted them to. And so I started thinking about myself and how I enjoyed chiropractic. Been going to chiropractor since I was probably 11 years old. You know, as a high school athlete, it really helped me, you know. And so I went to Options for Animals, College of Animal Chiropractic, and that was a 280-hour postgraduate course.
Jeez, that's
so
long.
It's a lot of time.
Yeah.
It's a very involved, very powerful course, and I learned a lot. And it was a lot to wrap your mind around, you know, being trained in Western medicine, you know, and then moving over to something that's, you know, to us we consider it alternative, but it's kind of an ancillary therapy that just builds on everything else that we do, you know. And I wanted to learn that, and so I could offer that to my patients, and it's something that I think all animals can benefit from.
Absolutely. Well, we see it, you know, in human medicine, animal medicine, but that holistic approach, that combination of Western medicine with the chiropractic, and
Right.
the combination could be very powerful. Have you seen an uptake, of these services?
You bet. It's something that is constantly growing. I get more and more people that are interested in it, and you tell people that, you know, I adjust horses, and they say, you got to be kidding me, you can't adjust a horse. Well, lo and behold, I can. You know,
Yeah.
It's kind of, and it's a lot of fun, and the horses will show you, you know, that they enjoy it, and it's always fun for me if I get somebody who's they're kind of a naysayer, or they kind of, you know, in the sheets about it, you know, they don't believe in it. Well, I'll adjust their horse, and they'll come back and tell me how much better the horse is doing. So I just let the horse talk.
And I suppose it's one of those, especially on the equine side, when you're in the saddle and you're feeling how that horse is moving before and after.
Right, for sure.
Probably pretty easy way to tell.
Yeah, for sure. You know, that horse is going to move a lot freer. He's going to do things that he wasn't doing before. Maybe he wasn't stopping as well as he should be. Maybe he's not turning. Maybe he's not picking up that left lead. You know, there's a lot of things that go into that. You know, and so I started into the chiropractics, and then I added into the acupuncture here a little over a year ago, and that's a whole different mindset. You know, you talk about traditional Chinese medicine, and it's weird for us because we don't understand how it works, but you know, a large portion of the world's society views that as primary care.
Yep.
You know, instead of going for a pill, they go for a needle.
Yep, and I've been over in China and worked with different veterinarians, and sometimes it's easier. They don't have a pharmacy so much, but
Right. They got an acupuncturist.
Absolutely. Well, we're going to have to take a break. This is some cool stuff, and we're going to get Jake out, and we're going to take a look and adjust him.
Yep.
And do it here for the show. And I just appreciate you taking the time out, and folks, we appreciate you watching DocTalk as well. We'll be back here after the break.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it from an ATV, on horseback, or just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Fair. We're in Great Bend, Kansas at the Animal Medical Center, and we have Jake Jackson here. And you can find out Jake is standing at stud, and he's gonna be our participant today for the chiropractic treatment. And you can find Jake on the website at www.jakejackspin.com. And it's all one word, JakeJackspin.com. So, Dr. Fair, take it away. Talk to us a little bit about your approach.
When we're looking at a horse for chiropractic issues, we start out, I'm gonna either watch them move, or sometimes I just listen to them. Some people I can hear if they're off. I can kind of listen to them, kind of think about what's going on. But I'm gonna do just kind of a general once over and kind of go over the horse, and I'm gonna be feeling for heat and looking for anything abnormal that I can just visually see. And after that, I'm gonna start doing what we call motioning the horse. And so with the chiropractic, the biggest issue with chiropractic is finding decreased motion in those joints. We always think of chiropractic as adjusting the bones, moving the bones. But in reality, what we're doing is we're affecting that nervous system more than anything. Okay. So if you think about the spine, like Jake's spine, he's got nerves exiting that spine, from the time it leaves the skull to it gets to his tail. So if those vertebrae in the spine are just stuck one way or the other, they cause inflammation around those nerves, and that's what causes the pain, and it causes inflammation and just all sorts of issues. We can affect everything from the way he moves to the way his guts move, through chiropractic.
I'll be dang.
So, I'll kind of go through some of what I do. I'm going to come back and I'm going to just kind of motion the way his pelvis moves and kind of feel to see if Jake's feeling the way he should. And so I'm not, this is what takes the longest as far as your chiropractic education is learning those
what to feel for.
Yeah. It's those little minute differences in how he moves that really tell me where he's out, you know, and what needs to be adjusted. So if we can kind of move him over here a little bit, I'm going to do, kind of feeling his back here, I'm going to do a motion called the hula. And you see I'm kind of hulaing his hips, and I'm just checking for the motion within his spine, you know. And so then what I'll do, if Jake will allow me, is we're going to get up on this bale, and we're going to adjust his spine here a couple places. Ooh, bud.
Oh, bud.
Oh, Jake.
Oh, Jake. Move him over to you.
Yeah, just kind of stand him there.
Okay.
So Jake's got a couple lumbars here that we're going to work with. Good boy. And you know, we talked about how horses are good about showing you when they like it. If you notice, Jake's moving his mouth, because Jake's been through this and he knows I'm making him feel better.
You can really see him pop.
Yeah.
With that.
Yeah, and so it's, you know, the chiropractic, a lot of people, when they think about equine chiropractics, they think about people with hammers and stuff like that. A true chiropractic adjustment is a very specific adjustment in a very specific angle, and it's a high velocity, low amplitude, so very fast, very short movement. And so that's a true chiropractic adjustment.
I'll be dang. Well, that's pretty cool, and let's take a break.
Okay.
When we come back, let's jump into more
Okay.
of your chiropractic medicine. This is some interesting stuff, folks. Don't want to go away. We'll see you here after the break.
This Meet the Veterinarian is brought to you by Merck Animal Health, the science of healthier animals. In 2004, Dr. Corbin Stevens founded Stevens Veterinary Services in Scott City, Kansas. Primarily a feed yard and cow-calf consulting practice, SVS also has an on-site IDEXX laboratory that tests cattle for persistently infected BVD in pregnancy. Dr. Stevens is also a partner in Production Animal Consultation, a multi-industry practice. He and his wife Heidi have 3 children.
You know, I think people are just kind of born with a passion.
I wouldn't be where I am today without that horse.
Oh, I'm not passionate about horses. That's just something that's in here. I can't explain it.
Some people go to a job every day. I just go do what I love to do. That's all I know, is horse.
The bottom line, we're for the horse. It's whatever we can do to make life better for the horse. Wherever they are, whatever they do.
They're just magic, that's all. They got me.
If we always do what's right for the horse, we will never go wrong.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
TrueTest Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Fair, and we're in Great Bend, Kansas at the Animal Medical Center, where Dr. Fair is veterinarian and has been providing chiropractic services now for quite some time. And we have Jake Jackson right here. That Jake is our participant and client for the day. So we're going to continue on, Dr. Fair?
Well, what I'll do, I'll go into and work with his neck here next. Easy, Jake. Ho. And so I'm going to continue. I'm just going to be feeling for, you know, decreases in motion through that neck. And then we'll do an adjustment here. Whoa, easy, Jake. Easy, Jake. Easy, buddy. Whoa, ho. So sometimes you can notice they do have a little startle reflex.
Absolutely.
And a lot of that is, you know, although we may not hear an audible pop, it resonates through that horse a lot of times when it pops. And so just that kind of that startle can kind of, easy, big guy. Here. You're all right. So I'm just kind of going down and I'm feeling that neck as it kind of moves along. Kind of get down here in that low neck.
He knows what you're doing, doesn't he?
Jake's had this a couple times, so he kind of, it's kind of interesting. It's kind of fun to watch the horses. If they've had it a few times, they kind of go right along with you because they know what's going on.
It's kind of like me and my chiropractor.
Right? Easy. Good boy. Good boy. So then I'm going to go ahead.
So tell me what you're feeling for. Just places where you feel like you don't have good movement or good motion?
Right, yeah, and very basically, yeah, I'm going along and I'm going to each joint within that neck. You know, there's 7 vertebrae in a neck. Right. And so I'm going to the junction between each one and I'm feeling that movement within that vertebrae or between those 2 vertebrae. And so that's where they get impinged, is where those facet joints come together, you know, and you can feel that if that is locked up, you know, I can feel it. It won't move like it should. Gotcha. And so then I apply an adjustment or a force through it.
Gotcha.
We'll go ahead and kind of go through.
What are you doing here?
We're going to go through his legs and make sure everything's moving. And there we had a pretty good audible pop, right? So that was in his carcass.
Boy, oh boy. Gotta feel better, Jake, after that.
Easy, buddy. Easy, buddy. Sorry, I'm kind of moving around. But
that's all right. I'll move with you.
Good boy, Jake.
Yeah, there's not a lot of stallions that you're going to...
No, Jake's a pretty good customer. He's a pretty level-headed guy.
So you go through the neck, go through the legs, lower back, mid back.
Go through everything, hips, withers. I mean, I move pretty much every joint in the body when I do an adjustment.
So when somebody's coming into the clinic for adjustments, what kind of price ranges do you hear people charge? Something like this.
I've heard of people charging upwards of $300 for an adjustment. In this area, it's a lot less. You know, we're not even 100 here.
Right.
You know, and so it varies, you know, depending on where you're at in the country and what kind of horses you're working on. But my philosophy is if I can keep it affordable, we can do more.
Big time.
You're not going to be, it's not going to be hard for you to bring him back, you know, next time he's hurting. But if it's $300, it's going to hurt you quite a bit too to bring him back just because he's hurt.
Well, you want to do what's best, and you do a lot of good work for him. I think we'll take a break. When we come back, let's wrap up and talk a little bit more about chiropractic medicine, some of the things you see as far as where we're headed with it.
Okay.
And sure appreciate you doing that. Jake, you've been a good customer. Thanks for bearing with us. Folks, thanks for watching DocTalk. We'll be back here after the break.
Hello, I'm Dr. Chris Blevins at Kansas State University Veterinary Health Center, and for the horse tip, got to be watching your horse's skin, out in the sun, sunburn. What do you do for horses that have sunburn, and where do you look for them? Mainly it's going to be every white area of the horse is more exposed or more apt to get sunburn on the horse, so especially on the muzzle, around the eye. Cancer can even be involved with that too, especially around the eyes. So keeping a close eye on those, if they don't even have pigmentation around the eye, is very important. Different things can cause sunburn in the horse, even what they eat. So always ask your veterinarian if you have any concerns and what you can apply on the skin to help prevent sunburn. With sunscreens and kind of fly mask can also be helpful of that aspect of protecting your horse skin in the sun.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Well, thanks for being with us today. It's been a great show.
It's been fun.
It's a great service that you're providing, and I know it's going to grow and grow. I'm amazed. It was the first adjustment I'd seen.
Is that right?
And you could physically see the movements, and it's just amazing.
It is. It's a lot of fun, and it's great for me, and it adds, something I can do more for my clients and for my patients, and it's just something that's so, to me, it's easy, and it's a no-brainer. You're sore. If I'm sore, I go to my chiropractor. If the horse is sore, bring him to an animal chiropractor. Get him adjusted. And I say animal chiropractor, it should be somebody who's been through the proper training. There's some guys out there that will put on a weekend training and show you how to do it that you can't learn enough through that to be anything more than dangerous.
Well, the other thing is we go through a lot of school to learn the nervous system, to learn the interaction of when it is chiropractic treatment necessary and when modern medicine needs to be applied. And I'm not saying it's not modern medicine, but we've got a lot of background in this, and it's important that we stay hooked.
Right, exactly. And they just, like I say, go for somebody who's got the credentials, and they're going to help you out. The chiropractic, it works. Instead of adding medicine, we work with the animal's innate ability to heal itself. Yep. And so we're doing it that way. If you have questions about the chiropractic or what I do, any of the things that I do, you can get a hold of me at AMC here in Great Bend.
Yep.
We have a website. It's www.myamcvets.com. We also have a Facebook page. So several ways you can get a hold of us.
AMC is Animal Medical Center, Great Bend, Kansas. Dr. Matt Fair, Dr. Nels Lindberg, y'all do a great job. I appreciate also all that you do for us at Kansas State. Not only for me and my program, but you do a lot for our students, and I just appreciate you giving back.
We're happy to do it. We enjoy the students coming out. It's a lot of fun.
Yep. Folks, you've been watching Doc Talk. Thanks for joining us today. Remember, always work with your local veterinarian. And if you want to know more about what we're doing on Doc Talk, you can find us at www.doctalktv.com or go on the web to find us at K-State at www.vet.ksu.edu. Thanks for watching Doc Talk. I sure appreciate y'all tuning in. I'm Dr. Dan Thompson, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.